Okay.
Okay. And can you allow me to share my screen, Pamela?
Okay, I think I did that.
Yep, we're good. So do you guys see the presentation?
I do. Do you see it, Ms. Quinn?
I do.
Okay.
All right. So, hello. You are the only person that registered and showed up for this presentation today, so we get exclusive access, I guess.
One-on-one. Right.
Well, can't beat that.
No,
And no masks.
no masks. This is a short and sweet presentation, just reviewing all the different enrollment periods for Medicare. Certainly, if you have any questions, feel free to ask.
Okay.
This is like a 10-minute presentation, and then any questions you have afterwards.
Sounds good.
All right. So we are, and this is in partnership with the Security Public Library. This is a fairly new partnership for us, but we're happy to be partnering with them, and hopefully we can get some good educational pieces out through that organization. So we'll start with who I am. I am with the Pikes Peak Area Agency on Aging, and the mission of the Pikes Peak Area Agency on Aging is to develop and coordinate systems and programs that help people stay independent and in the community for as long as possible. The Area Agency on Aging here is located in Colorado Springs, but it serves 3 counties in Colorado, El Paso, Park, and Teller, to provide these services. Within the Area Agency on Aging, I am with the SHIP program, or State Health Insurance Assistance Program, which is a federally funded program that's designed specifically and solely to provide information and education in a free and unbiased way to anybody interested, whether it be beneficiaries, family members, professionals, anybody interested in learning more about Medicare. And we can help people with learning about original Medicare, all the different parts of Medicare, Part D, the drug coverage, all the options available to go with Medicare. We can also help people understand their retirement benefits, or help people who have limited or low income apply for financial assistance with their Medicare costs and coverage. The SHIP program through the Area Agency on Aging actually serves 9 counties in Colorado. So we are responsible for providing information and education to a total of 9 counties, which I've listed on the slide. Every state, every county and every state has access to a SHIP program, at the very least through a statewide toll-free number. I've listed both our local Colorado Springs number as well as Colorado statewide number. If you call the Colorado statewide number, it'll route you to the SHIP office closest to where you're calling from. All right, so again, today we're going to be talking about the different enrollment periods available through Medicare and who they apply to. So we're going to cover the initial enrollment period, special enrollment periods, the annual general election period, the newest annual election period, also referred to as typically just open enrollment, and then the new annual Medicare Advantage Plan open enrollment period that's been around only since 2019. And we're going to talk briefly about each of them. So the initial enrollment period is for people who are just becoming eligible for Medicare. And that's typically by turning or becoming eligible by turning age 65, or if on disability, it's your initial enrollment period is after 24 months of disability. The initial enrollment period for just becoming eligible for Medicare for the first time is a 7-month window. That 7-month window starts 3 months prior to the month of your 65th birthday, includes the month of your 65th birthday, and up to 3 months after the month of your 65th birthday for most people. During that 7-month window, you can enroll in Medicare at any time without penalty. However, if you enroll during the 3 months prior to the month of your 65th birthday, your benefits won't start any sooner than the month of your 65th birthday. If you enroll the month of your birthday or during the 3 months after your birthday, there will be a delay in the start date of your Medicare benefits, 1 to 3 months. For most people, they should enroll during their initial enrollment period unless they are still actively employed and have employer health coverage through that employment, or are the spouse of someone actively employed and are covered through that person's employer health coverage. And we'll talk about that a little bit more as we go. If you don't take advantage of this enrollment period when you first become eligible and you're not actively employed, or the spouse of someone actively employed with employer group coverage, if you don't enroll during this period, there are other opportunities down the line to enroll, but it could potentially create a penalty situation when you do enroll. So again, for most people becoming eligible for Medicare for the first time, unless you're working or the spouse of someone who's working, you typically want to enroll during initial enrollment. If you are working and have employer coverage, or the spouse of someone who's working and you're covered under their employer coverage, you can delay enrollment in Medicare, both A and B, or A or B, without penalty. So if you are actively employed when you become eligible and are covered under employer group coverage, you can simply ignore enrolling in Medicare until you're ready to stop working. Once you are ready to stop working for whatever reason, and you're getting ready to lose that employer group health coverage through active work, you get what's called a special enrollment period. This scenario only applies to people who delayed Medicare enrollment because of active employment. While you're actively employed past your initial eligibility, you can enroll in Medicare at any time for any reason, no questions asked, because you're still working, but you're still in initial enrollment. When you stop working, you have an additional 8-month window to enroll in Medicare without penalty, based on the fact that you delayed because of work. So it gives you not only an extended period of time once that employer coverage ends to enroll in Medicare without penalties, as if you're in your initial enrollment, but again, you can enroll at any time while you're still actively covered under active employer group health coverage. If you didn't enroll in Medicare when you first eligible because of work, but you don't enroll in Medicare within that 8-month window from the time employer coverage ends, again, you would still have an opportunity to enroll in Medicare down the road, but because you didn't take advantage of your initial enrollment or special enrollment, there could potentially be penalties that you would have to pay when you do enroll. Most people will fall under these first 2 enrollment periods. That's pretty typical.
Yeah, we're self-employed, so yeah.
So self-employed people have a little different scenario when it comes to health insurance and employer coverage, because you are, I'm assuming, a small employer. Do you have business health coverage, or do you go through the marketplace?
Actually, we have Medicaid. As much as I
Okay.
hate to, yeah.
Okay. So, I mean, certainly you're going to want to take advantage of the initial enrollment period.
Exactly.
And even if you had employer coverage because you had employees, if you had less than 20 employees, you would still strongly be encouraged to enroll during initial enrollment, because unless you have 20 or more employees, the special enrollment for employer coverage wouldn't work. So there are some additional roles to that special enrollment period for people who work. But I wasn't going to get into that because it's a general overview, but yeah, you would be really encouraged to enroll during initial enrollment.
And that's the intent. That's why I've already attended a couple seminars, so just trying to stay on top of it.
We
Just
appreciate
my
that.
husband and myself, so there is no other employees.
So again, if you don't enroll during your initial enrollment period, you don't have the ability to take advantage of the special enrollment period. You would have the ability to enroll in Medicare any year down the road during the general enrollment period. So Medicare will allow someone to enroll in Medicare any year in the future between January 1st and March 31st. If you enroll during that time frame, specifically because that's the only time you can enroll, coverage usually starts July 1st of that year. So there's still a delay when the effective date is. That has always been the way this general enrollment period has worked. However, they are changing that next year so that there is no longer that delay if you enroll during the general enrollment period. Between January 1st and March 31st, your coverage will start the first day of the next month, starting next year. That is a pretty big change for Medicare. And people think Medicare changes all the time. It really doesn't. Just the options change for stuff to go with Medicare, but this is a pretty big change for Medicare. And it's a positive change because it gives people coverage sooner. However, if you are enrolling during this general election period or general enrollment period, you're likely to have to pay a penalty of some sort on your Medicare premium. Most people only pay a premium for Medicare Part B. So the penalty would be applied to Part B. And the way that penalty works is Medicare and Social Security are going to calculate a 10% penalty to the monthly premium for every 12-month period past your initial enrollment period that you've been without Medicare. If somehow there are less than 12 months between when you should have enrolled it or could have enrolled in Medicare and the general enrollment period when you do enroll, you won't be imposed a penalty. But if there's 12 months or more, you'll have to pay an extra 10% of the Part B premium. And they just simply calculate that based on the monthly premium for the year you enroll, and then count backwards to how many months you missed. And if it accumulates to 12 months or more, 10% for every 12 months multiplied by that month's premium. And then whatever that comes out to is tacked on top of the premium forever and ever and ever and ever. Penalties never, ever go away. So it's strongly encouraged that you take advantage of other enrollment periods to avoid the penalty, because it may not actually end up being a whole lot of money, but every month forever and ever can add up before you know. So those are the initial enrollment periods, or the most used enrollment periods to get into Medicare. Once you have Medicare, there are a couple enrollment periods to be aware of as well. Primarily, the annual election period, which we generally refer to as open enrollment every year, is the enrollment period that's been available since Part D came around in 2006. That is the fall enrollment period of October 15th through December 7th every year. And during that time frame, you have the ability to either get into, get out of, or switch from one plan to another for Medicare Part D standalone plans or Medicare Advantage plans. So again, during between October 15th and December 7th, you can get into, get out of, or switch from one Part D or Medicare Advantage plan to another. Any change you make during that time frame goes into effect automatically January 1st of the next year. So whether you have an Advantage plan or a Medicare Supplement Medigap and a separate Part D, this is still an enrollment period everybody should be aware of. And it's an enrollment period you're strongly encouraged to take advantage of to review your coverage, especially if you have a standalone Part D, to make sure that you have the most cost-effective Part D plan available to you every year. And for people who do the standalone Part D plan, those plans do change much more frequently from year to year. And it is always to your advantage to review your options for the next year, again, to make sure you have the best saving plan available. A lot of people change their Part D plan every year, simply because they tend to find something better every year. Not so much with Advantage plans, but it is an opportunity for people to look at the other Advantage plan options that might be available to see if they want to try something new. And then the last enrollment period we're going to talk about is the newest enrollment period. This went into effect in 2019, and it is the Medicare Advantage open enrollment period. This enrollment period is specifically and solely for people who are on or enrolled in a Medicare Advantage plan as of January 1st of any year. So whether you enrolled in an Advantage plan during the open enrollment period of October 15th through December 7th, and that starts January 1st, or if you've been in an Advantage plan for years. If you're in a plan as of January 1st of each year, you have another opportunity to change that plan or get out of that Advantage plan between January 1st and March 31st. So this is kind of gives people who have second thoughts or who decide that the plan they enrolled in is not going to work for them because their doctors don't participate or whatever, gives you an opportunity to change that plan. Or again, if you have second thoughts, you can get out of that plan completely and go back to original Medicare with a Part D. If you don't have an Advantage plan, if you're not actively enrolled in an Advantage plan on January 1st of any year, this enrollment period does not apply to you, period. It's only for people enrolled in a plan on January 1st and gives them an opportunity to either change that plan or drop that plan completely. And this, again, is the newest enrollment period for Medicare. So it kind of gives people with Advantage plan a second opportunity to make a change or to get out. So that is the 5 primary enrollment periods for Medicare. Did you have any questions about any of that?
The Advantage plan, so you have to sign up for whatever that is when you initially sign up for Medicare.
So if you decide that you want to do an Advantage plan, when you first become enrolled in Medicare, you can sign up during that initial enrollment window so that the Advantage plan starts at the same time as your original Medicare or within 3 months of getting original Medicare in effect.
But if you don't do it then you don't have a chance to?
If you don't enroll in an Advantage plan when you first become eligible during your initial enrollment, you would have the opportunity to enroll in an Advantage plan at any year down the road during the annual enrollment period or open enrollment.
Okay.
So you can get into a plan, you can get out of a plan, or you can switch from one plan to another during this October 15th through December 7th window.
Okay.
So, if you decide to go with, say, a Medigap when you first get Medicare, and you have that for a few years, any year down the road during open enrollment, you can drop the Medigap and get into an Advantage plan if you want to try it.
Gotcha.
If you decide to enroll in nothing besides Medicare during your initial enrollment, you can still, any year down the road during open enrollment, enroll in an Advantage plan if you want to.
And what is an Advantage plan? I mean, is that something you cover later on?
So that is an option for coverage to go with Medicare once you're enrolled in original Medicare. Are you participating in our Medicare 101s this month?
Yeah, I'm going to. Yeah.
Okay. So we covered Medicare Advantage plans and Medigaps last week. And if you missed any of that, we do have a recording of it posted on our website for review, as well as the handouts that came with that presentation for download. Actually, what is today? Today is the 15th. So, that actually might be what we're covering tomorrow. If we're doing week 2 or part 2 of the 4-part series, that's what we're going to talk about tomorrow in depth. The difference between Advantage plans and Medigap plans and how they work.
Different signups. There was one that's every Wednesday. It's like Wednesdays, and then a different one on Thursday. So I was a little confused as to.
Yeah, it's the same webinar, but the ones that we're doing this month on Thursday evenings are through the Pikes Peak Library District. The ones we're doing next month on Wednesday evenings are through the Security Library. but it's the same presentation. So either one you attend is the same information. So yeah, sorry for any confusion on that. We're just trying to get as much outreach done to as many people as we can with as many partners as we're able to. So how did you find out about us today?
Peach Jar through the school system. They push out information that way.
Okay. Yeah, we just met with the local library yesterday afternoon and she mentioned that. Well, good. Well, this is pretty much the whole presentation.
Oh, okay.
Unless you have other questions, it was just like a brief
No.
review. Again, the Medicare 101s is where we go into a lot more detail about any and everything regarding enrollment periods and your options to go with Medicare. So to wrap up, let me just reiterate. I am with the SHIP program, State Health Insurance Assistance Program, which is a federally funded nationwide program available to everyone in every state. And again, I have listed our statewide toll-free number, as well as the national website, SHIP TA Center, if you want any additional information or have any interest in doing volunteer work for this program.
Right.
And our office through the SHIP program also helps people when they are worried about potential fraud with their Medicare benefits. So we can help people understand Medicare fraud, errors, and abuse, as well as do educational and outreach efforts for that particular topic. And I've listed the statewide number as well as the website as well. That program is also always looking for volunteers. And that is it.
All right.
Again, our local number, our statewide number, and an email address. You're always welcome to email any questions or concerns as well.
Okay.
Roma, I just admitted Mr. Rose. So I don't know if he needs anything to be reviewed at this point since I just admitted him.
Well, I mean, certainly this is being recorded and it will be posted to our website as well as our YouTube page. I'm also happy to email the handouts, this presentation, if that would be helpful.
Yes, that would be very helpful. You didn't come on to my screen until 20 minutes late.
Oh,
Yeah, that was my fault. I take responsibility for that.
okay. Our apologies.
Yeah.
This has been recorded and it will be posted to our website and our YouTube page. And I am happy to email both of you the handouts for this webinar so that when you watch the recording, you can kind of follow along.
That would be helpful. Thank you.
Are we
You're
doing this one again, Roma? Are we doing this open enrollment, what you did today, in a different lunch and learn? Do you know that yet? Have we planned that for
I
the next
can't
12 months? Okay.
off the top of my head. We're certainly able to if we need to, but I don't remember my schedule for this next couple of months at this point. There's a lot of stuff going on. But certainly if we are going to do this one again, it will be posted to our website under events. So again, I apologize that you got in late, but did you have any other questions, Ms. Quinn?
No, thank you.
All right. Well, we have your registration email. You will actually get an email sent to you with a link to this recording in the next 24 hours probably, as well as I will personally email both of you the handouts, the slides for this presentation. So if you have any questions, again, my email is up on the screen. You're more than welcome to shoot me an email with any specific questions or concerns, or you're always welcome to call us at our local Colorado Springs number. But unless there are other questions, I will let you guys finish lunch.
Thank you.
Thank you. And thank you for attending, and hopefully we'll see you again.